So after having an open heart surgery, doing this one thing can help you have lower mortality and have fewer hospital readmissions, having a much improved chance of success. And yet, about 50% of patients do not do it. What is that one thing? Let's talk about it. What's up, y'all? This is Carolina Doc PT, and in today's video, we're going to be talking about something that when I was in home health physical therapy, I would run into quite a bit with patients who were just out of open heart surgery. So we would typically go in home health in those first, a few weeks after the patient has discharged home from the hospital after having had that cabbage or whatever type of open heart surgery that they were having. And then we would work with them for somewhere generally in the 2 to 4, maybe even 6 week range, kind of depending. And the patients, a lot of times, because it's so convenient for physical therapists to actually be coming into their house, would want us to either continue with them, or they would want to discharge altogether. And that is not a good idea. If you are somebody who is a current patient, or you have a family member who is in this situation right now, I will tell you, just like I would tell my patients then, it is really, really important for you to attend cardiac rehab, okay? Studies show that people who actually attend cardiac rehab after having had an open heart surgery report consistently significantly lower mortality rates after the surgery. They have significantly less hospital readmissions. They also just recover better and get back into a fuller life. I think you could say. It's crazy to me that more people don't take advantage of this. The studies have also shown that of about 75% of patients who were actually referred to cardiac rehab after having had a cabbage, only about 19 to 30% of those patients actually take advantage of that and attend cardiac rehab. That is a huge mistake. Okay, I highly would recommend that if you have had an open heart surgery of some kind, that you do your cardiac rehab. It is extremely important. So home health physical therapy, for example, when physical therapists come into your home right after you've had that type of a surgery, we're going to be working with you at a low intensity. Okay, we're going to be working in an easy range and wanting you to do that a lot throughout the day, every day, like the exercises that we're having you do. Well, as you continue to get stronger, and as your stamina improves and your strength improves, you're going to want to continue on with that, and then work at those moderate exercise levels and those high intensity exercise levels. It's to not do so is just asking yourself to have, well, you're just asking for a lot of problems, we'll just say. One of the things that I would always use as a selling point, and I think it's very true, that after patients have had open heart surgeries, a lot of times one of the things they have, and one thing that you notice, is that they have a fear. They're not sure what they can actually do. So there can be a lot of fear around, well, how hard can I actually work my heart, and what activities would actually be too much for me. So in early on in home health physical therapy, we're not wanting to explore those higher intensity levels just because of the risk involved with that. A lot of times, you're deconditioned right after you've come home from the hospital, because you may have been in the hospital for a few days, and so your body's weaker. You're, just not moving, as well. And so we're working low intensity and then want to progress you along. Well, you want to continue that progress and work at that higher level. And that's what the cardiac rehab folks are going to do. So in cardiac rehab, you're typically going to be working with exercise physiologists. You could have a physical therapist in cardiac rehab. You may be working with nurses in cardiac rehab. And what they'll be doing is they will be taking your blood pressure, checking your heart rate while you're actually exercising. They may put, lines and leads on your chest and actually look at your heart as you're exercising and see, how well is it beating, what is its function looking like. So there's a lot of benefit to actually attending cardiac rehab that can help to address things like that big fear, which personally I would say that's probably one of the biggest things that I have kind of encountered with patients, and that they'll admit to as kind of having and I say fear, I mean, with some patients it's a fear, some it's maybe just a not lack of understanding, but just not knowing, just a question like what can I actually do. And so cardiac rehab is for those folks that want to explore, and not that want to, but that should, which is meaning 100% of y'all, pretty much. Well, excuse me, we'll say 99% of y'all that have had this surgery. So that you'll get into that, and you'll be able to return to your prior level of function before you ever had heart issues, Lord willing. But then I would strive for even better than that. So one of the things that I would tell cardiac patients that I would work with is like, look, you need to go to cardiac rehab. And what cardiac rehab research has shown is that if you will attend that for about 36 visits, which is generally going to be about 3 times a week for about 3 months. Then after you've done that level, that's a frequency level that shows a high amount of benefit from it, and really the most amount of benefit that you can get. Then after you've done that, now bounce yourself over into a gym membership and continue those successful habits, those good benefits that you're seeing during those 3 months. Move that over into a gym and now continue that as a lifestyle change, so that you don't have to have another heart surgery, so that you don't have to worry about that in the future, and so that you have no limitations, and so that you can return to fully living your life. So it's crazy to me that despite the benefits of cardiac rehab, so many people don't take advantage of it. And so that's where I wanted to do this video. I did a previous video, which I'll link to this one, talking, about all the things that you can do to have a successful recovery after going through an open heart surgery. And so I'll link that video to this one. But then I thought that talking about this topic, I mentioned a little bit in that other video, but I thought about making this its own video was really important, because so many people don't actually attend cardiac rehab who should be going, and they're missing out on the benefit. They're not having as good a recovery as they could have if they would actually fully do the rehab. Fully doing the rehab is not just doing the home health physical therapy, but continuing on into cardiac rehab for about 3 months, and then going on into a gym membership after that. So I hope that this video will find you receptive to the information in it, and hopefully it is helping to encourage you, or maybe you're able to show this to your family member and get them to actually consider and actually attend cardiac cardiac rehab after their open heart surgery. So that certainly is what we hope will happen for you, and we'll be saying prayers to that effect. If you like this video, please give it a thumbs up and click that button. That can help us out a great deal. Also, if you have not already and you like this type of physical therapy information and education, please subscribe to the video by hitting that below. And thank you very much, and we'll catch you next time.